So yesterday we studied about pre-malignant lesions of oral cavity, and we studied oral ulcers, causative agents, multiple, acute, and chronic, and then recurrent. Today we are going to study about malignant tumors of oral cavity. Okay, so introduction. Oral cancer is one of the leading cancer worldwide. It's one of the leading cancer worldwide. And then oral cancer is the most common in certain countries. For example, Sri Lanka, India, Pakistan, Bangladesh, in parts of India. Oral cancer more than 50% of all the cancer in parts of India because of the causative agents, because of the etiology, smoking and chewing tobacco being the number one. So in certain parts of India, it's like represent more than 50% of all cancer. That's why it's important to study here. Based on 2017 data from US, the estimated 5-year survival rate for oropharyngeal cancers is approximately 66%. Lip carcinomas generally have best 5-year survival rate, which is 88%, and floor of mouth has the worst, which is 54% 5-year survival rate, depending upon the use of anti-cancer treatment like radiotherapy, chemotherapy. And then those with HPV positive tumors respond better to chemotherapy or radiation therapy than those with HPV negative tumors. So you have oral cancer or tumor and it is HPV positive, then we have more chance to heal it with the help of chemo or radiotherapy as compared to HPV negative ones. Okay, so here is a diagram. Oral cavity originates in the oral cavity, oral cancer. It can be at number one, hard palate, gingiva, gums or gingiva, and then retromolar trigone. Behind the molars, there's a triangle anatomical area present which has 3 boundaries, goes back. It makes a trigone known as retro behind molar, behind the 3rd molar, trigone, an area with a triangular surface area. And then there is buccal mucosa, buccinator muscle inside mucous membrane from inside. And then there is tongue, especially anterior 2/3 of tongue. And then floor of mouth means under the tongue, and lips. These are some of the places, and also oropharynx. Especially these are some of the places or sites common for the oral and pharyngeal cancer or oropharyngeal cancers. Okay, do not forget these sites. Approximately 90% of all the oral cancers are squamous cell carcinomas. So today our topic will be focused on squamous cell carcinomas. This is a relatively smaller presentation, smaller lecture, so pay attention. Everything is important, but everything is important. The common sites inside the oral cavity for the oral cancer includes lateral border of the tongue, oropharynx, and floor of the mouth. Lateral border of the tongue is also favored for leukoplakia and erythroplakia or erythroleukoplakias, and then or plakic lesions, and then oropharynx, and then floor of the mouth. These are the common sites for oral cavity cancers. Usually presents as a red lesion, erythroplakia, white lesion, leukoplakia, or a mix of the two, erythroleukoplakia, along with an ulcer then can be an ulcer present. So either it can be erythroplakia, red, which is red lesion, or leukoplakia, which is white lesion. In the absence of any other clinical picture, this is the diagnosis of exclusion, or it can be a mixed leukoplakic or erythroplakic lesion with an ulcer. So these are all the signs for oral cancer. Early oral cancer is asymptomatic. Cancer is one of the syndrome or disease which can have multiple disease at the same time, is a process. And then the silent killer is one of the silent killer other than being MI and autoimmune diseases. Autoimmune disease, when flare up, they are very symptomatic, but when they are not flared up, they are hidden, they are asymptomatic. Same as these cancers, they are asymptomatic initially, but when the symptoms appear, it's usually a little late. Early oral cancer is asymptomatic, which contributes to delayed diagnosis. So the diagnosis is delayed because of the absence of the symptoms. Any single ulcerated lesion persisting for more than 3 weeks. So you find an ulcerated single lesion, any lesion which is single and causes ulcers and which exists for more than 3 weeks, more than 3 weeks. This is the borderline, yeah, should be regarded with suspicion, and a biopsy or tongue scraping should be performed. The mnemonic or rule is, mnemonic is rule: R for red, U for ulcerated, L for lump, and E for extending for 3 or more weeks. If the lesion is red, if it is ulcerated, it's look like a lump of irregular mass, and it extends for more than or equal to 3 weeks, is an aid to diagnosis. Aid to diagnosis means it helps in diagnosis. Diagnosis towards oral cancers. Okay, perfect. So these are some of the pictures of oral cavity. As you can see, whitish pseudomembrane irregular, and then there is whitish irregular membrane with reticular changes. As you can see there are the transverse or horizontal, and here they are vertical. And then this lesion, the number C, this lesion is basically irregular. If you can follow along the red line, is irregular, is has whitish and reddish and erythroplakic lesions, and then it's bleeding also root towards the lower. That's why it reaches the arteries, the vessels, and then we have bleeding. So it has an ulcer, also bleeding ulcer with whitish and reddish erythro and leukoplakic regions. So this can be a sign for oral cancer, and then we take scraping or take biopsy and send it to pathological lab to confirm is it squamous cell carcinoma or what kind of oral carcinoma. And then we have at the buccal cavity, is the inner side of the buccal cavity, because you can see the teeth here, and these areas are the lateral lip angle is open, wide open, so that the lesion can be seen clearly. It's also erythro and leukoplakic region. But here we also have a lump which extend peripherally. Lump mass is growing peripherally. So this can also be the symptom. This lesion can also be malignant in nature. And then 10 facts about oral cancers. Oral cancer, number 1. Oral cancer is 2 times as common in men as in women. So men have more incidence. Incidence is new findings of new cases of cancer, right? Men has more incidence than in female. And then about 95% of oral cancer cases occur for people over the age of 40. However, this cancer can affect all ages. Point number 3, 1 in 4 of those diagnosed with oral cancer do not have any risk factor. So basically 1 in 4 of the oral cancer, if these 4 people have oral cancer, then among them 25% or 1 in 4 patient will have a oral cancer without a previous risk factor. Like he's not doing smoking, he's not chewing tobacco, no areca nut, or no risk factor and still having oral cancer. So it's not necessarily to be having a risk factor. Okay, how to, okay. And then number 4, all forms of tobacco. What do you mean by all forms of tobacco? What do you mean by all forms of tobacco? Farouk, roll number 6. What do you mean by all forms of tobacco?
Sir, any kind of smoking.
Or chewing tobacco?
Smoking and alcohol.
Okay, perfect. Perfect. Forms, yes. Thank you so much for your answer, Farouk. So Farouk, his mean was or any form of tobacco, either we are chewing or we are smoking it, that can be a risk factor for the oral cancer. Okay, and then we have alcohol also as a major risk factor. These two were already risk factors for a lot of pre-malignant lesions as well. And then point number 5, close to 53,000 Americans will be diagnosed with oral or oropharyngeal cancer this year. So every year there are increasing risks because of increasing risk factors. We have increasing incidence rate. So because we do not have data for Pakistan or any other country, so we go for WHO's guideline, and they have presented a data for 53,000 cases in America. Then we have point number 6, oral cancer kills roughly 1 person per hour, 24 hours per day. So almost in the world or US, and I'm not sure, but it kills 1 person in 1 hour. So that much common. Okay. Regular dental checkups can provide early detection of oral cancer. So regular dental checkup is important. So these are the 10 facts about oral cancer we should know. Ulcer plus lumps in your mouth are 2 symptoms of oral cancer. Very frequent and very common. There can be lumps along with ulcers. Early diagnosis can double your chance of survival. Screening for oral cancer takes less than 10 minutes. And there are many techniques of self-screening or self-examination or self-screening of oral cancer. Later we will study in this slide. So etiology, what do you mean by etiology? Causes. The cause of oral cancer is multifactorial. What do you mean by multifactorial? Let's ask someone. Can we go down? Muzammil Khan, roll number 60, Money Heist. Tell us, what do you mean by multifactorial? Ask to unmute, ask to unmute, ask to unmute. Roll number 50, Ayaz Khan. Help Muzammil Khan to, and yes, tell us what do you mean by etiology is multifactorial?
Many factorial threats mean that many things involved in the cancer of mouth.
Okay,
like
thank
alcohol.
You. So, okay.
Yes, sir.
Yes, sir. Who are you?
Sir, it's me, Muzammil Khan.
Acha, Muzammil Khan. Okay, thank you so much, Ayaz Khan. Muzammil Khan, can you tell us some of the factors or causes for oral cancers you know from the previous lectures?
Yes,
the
sir.
causes. Yes, continue. Causes of some oral cancers or pre-malignant lesions? What can be the causes of cancer development in oral cavity? Any idea?
Yes, sir. I think
It's okay. Say anything. Say anything. Come on. You can do it. You can do it. Come on. What are the causes? What do you think can cause cancer in oral cavity? What do you think?
sir, it's
Tobacco. Do you think smoking can cause oral cancer?
yes, sir.
Okay. Okay. Alcohol can cause.
Alcohol and HPV.
Okay. Okay. Thank
Yes,
you so
sir.
much. Okay. Thank you. Thank you for your answer. Let's continue. Okay. So etiology is multifactorial, means there are multiple factors which cause cause of the oral cancer. Number one, strongly related to lifestyle. This one is strongly related to lifestyle. How? Mostly habits and diet, particularly tobacco alone or in combination with betel or areca nut and alcohol use. So we have some habits and diet, particularly like tobacco, betel nut. A lot of Chinese, they have betel nut in their mouth during winter. Alcohol, and then diet poor in fruits and vegetables because absence of fiber. Then we have HPV, here human papilloma virus, and then diet is covered, tobacco is covered, alcohol is covered, and then immune defects or immunosuppression can cause hidden reinfection, which can lead to lesions with ulcers and lumps, and overgrowth will change into tumor, and then it will become malignant. Final year, come on. Defects of carcinogen metabolism or defects in DNA repair enzyme. Of course, we will talk about the cell cycle. There can be a problem in cell cycle and then DNA repair mechanism. Yeah, S phase, synthesis phase. And then we have any metabolism, any reaction in our body which leads to the formation of some carcinogens can cause oral cavity cancer. Sunlight exposure, because UV rays predisposed to lip cancer. Syphilis, poorly fitting denture. What is denture? Braces. The braces, the metallic wire or braces used to align your dentine, your secondary dentine, yeah, denture. So dentures. Lichen planus is also in the last slide. In the last class, we have studied pre-malignant lesion. Okay, pre-malignant lesion, which can change into malignant lesion. Okay. So next, again, the common sites for oral tumors. On the left side, some oral tumors or some oral squamous cell carcinomas, OSCCs, arise in apparently normal mucosa, but many are preceded by clinically obvious, potentially malignant disorders, especially erythroplakia, leukoplakia, erythroleukoplakia, or verrucous leukoplakia. Early carcinomas may not be painful. However, later, early they are asymptomatic, we know this, but later they may cause pain and difficulty with speech and swallowing. So where to look for the oral cancer, oral tumors? In the mucosa. You see the two fingers. The examiner is examining the intraorally the patient's oral cavity, intraoral examination, and then you can see he's checking mucosal surface of upper lip, and then gingiva and lip externally, and trying to find a lump or any lesion inside, or mass or growth, and then buccal mucosa, posterior gingiva, lower lip mucosa, vestibule. Remember vestibule. Remember anatomy in anterior gingiva, posterior gingiva, hard palate, tonsillar area, fauces, platoglossal folds, soft palate, ventral surface of tongue, floor of mouth, lateral border of tongue. Among these, which are the favorite sites for the oral cancer? Lateral border of tongue, floor of mouth, hard palate. Where is hard palate? These are and buccal mucosa. These four are the most favorite site for the oral tumors, oral cavity tumors, oral cancers. And then oral cancer common sites again, these in another picture: dorsal of tongue, ventral of tongue, hard palate, and then towards the oropharyngeal isthmus, towards the lower lip, and then goes and buccal cavity or lips. This is basically lips, and then lateral side of the tongue. Clinical features. So clinical features, among clinical features, we have some lesions. We have some lesions of this. These oral squamous cell carcinoma may manifest as the following lesions. It can be a red lesion known as erythroplakia. It can be a granular ulcer with fissuring or raised exophytic margins. This is tongue, and then there can be fissures, cracked tongue, and then from cracked tongue there can be also raised granular ulcers, raised margins, cracked tongue. Okay, a white or mixed white-red lesion. What do you mean by white lesion? What is a white lesion called?
Leukoplakia.
The absence. Okay. Thank you. So we're gonna surprise someone and ask someone about mixed white and red lesion. Okay, mixed white and red lesion. Hassan Naki, roll number 61, will tell. Mixed white and red lesions are known as.
Yes, sir.
The mixed white and red lesions are known as. What is the name? Another name for the white and red lesions when they are mixed together?
The red lesions are called erythroplakia.
We don't have any idea.
No, sir, I'm saying that red lesions are called erythroplakia,
Yes. Yes.
and the white and red lesions are called filtered number.
It's not clear, but it's okay. So what he was trying to say is, actually he was smart enough to know that if red lesions are known as erythroplakia and white lesions are known as leukoplakia, then red and white mixed lesion will be known as erythroleukoplakia. Okay, very smart answer, very good. Okay, perfect. So Junali, okay, so we have a red lesion. It can be a red lesion as a clinical feature. It can be a granular ulcer with exophytic margins. It can be a white or mixed white-red lesion. It can be indurated lump or ulcer, a firm infiltration beneath the mucosa, indurated. It can be non-healing extraction socket. So for example, you pulled out a tooth and the socket is not healing. It's either bleeding or it's getting and bacteria, getting pus, getting infection. It's not healing. You take the teeth out, you take a tooth out, you went to dentist, and now your cavity, that the socket is not healing. This can also be a lesion or a clinical feature for a malignant lesion, and a lesion fixed to deeper tissues or to overlying skin or mucosa. So these are 6 or 7 lesions which can be a clinical feature, which can present as a clinical feature for oral cavity cancer. And now on the right side, we have some common signs and symptoms. Lip or mouth sores that bleed easily and don't heal within 2 weeks. Why bleed easily? Because carcinoma are usually invasive. Malignancies are usually invasive, and then they invade. They are not usually carcinoma in situ, CIS. They invade to the deeper layers, basal layers, and then they reach to the arteries. And when they reach to the arteries, the ulcer will bleed. And then we have a rough spots or crusty areas on your lips, gums, or inside of your mouth. You take the biopsy and confirm it's not candidiasis, not bacterial, it's the leukoplechic, is either it's benign or malignant. So actually the previous pre-malignant lesions are now converting into malignant lesions. And now or tenderness on your face, neck, or mouth that occurs without cause. So any numbness or pain or tenderness along the face area, neck, or mouth area means an invasion of oral cavity cancer towards the nerves, which can be a cause of oral cancer. And then of course, if the oral cavity has some tumor and then pain, then there will be difficulty chewing, swallowing, speaking, or moving your jaw or tongue. There will be difficulty. Then unintentional weight loss. What do you mean by unintentional weight loss? Let's ask someone. You go. Let me ask someone. So, Sanaullah, roll number 15. What do you mean by unintentional weight loss? How weight loss is attached to the cancer? Sanaullah, are you here? So Sanaullah, what he wanted to say was unintentional weight loss means the weight loss which is not being done intentionally by the patient or the person, because he is not actively trying to lose weight, but the weight is being lost. Sanaullah says, yes, sir, I hear. Okay. You hear or you are here? I don't understand. I think he wants to say, I am here. Okay, thank you, Sanaullah. We now know that you are here. So Sanaullah said that unintentional weight loss was the weight loss which is not being done intentionally. So then, of course, it can be due to the anorexia or the weight loss of the cancer. So a lot of cancer in our body. Thank you. Thank you. Yes, sir, I'm here. Thank you, Sanaullah. Thank you. Can you please mute your mic? Thank you. Okay, perfect. So weight loss is a common feature for a lot of malignancies and cancers. Then earache. Why earache? Because the nerves, if the nerves and the cancer invaded the nerves, then it can be maxillofacial or area or that area even to the trigeminal nerve. Yeah, so it can extend beyond the borders. And then we have chronic bad breath. But what is the other name of bad breath? We can ask Asad Mukhtar, roll number 56. What is the other name for the bad breath? Bad breath is also known as
Yes, sir.
yes. So bad breath is also known as what is the medical term for bad breath? Can you see this?
Yes, sir.
Bad breath. Yes. Do you know or not? It starts
Sorry,
with
sir.
H. Halitosis. You know halitosis?
Yes, sir.
Speak this word. What is this word? Halitosis. Say halitosis.
Halitosis.
Okay, perfect. Thank you so much. Okay, so these are some of the clinical features and some of the signs and symptoms for for the oral cancer. And now we go to the symptoms of oral cancer. Again, a sore on your lip or mouth that does not heal. Does anyone know any sores on the mouth or lip? There are two sores we have studied, starting from C. Anyone?
Sir, the cold
Sir,
sore.
cold sore.
Okay. Let
Canker
the
sores.
canker sores. Okay. One more. Okay, cold sores, canker sores, and cold sores. Yesterday we revised in our lecture. Okay, the symptoms of this time Viva is gonna be tough. The symptoms of actually it's not tough. It will be common questions, but you'll make it tough for yourself by not studying. Symptoms of oral cancer are sore or on the lip or mouth that does not heal. So it's not healing. Any sore is not healing without medication, of course. A mass or growth in the mouth or lump in the mouth. Bleeding from your mouth. Loose teeth. Pain or difficulty swallowing. Double wearing dentures. A lump in your neck. An earache that won't go away. Dramatic weight loss. Lower lip, face and neck, chin numbness because of the nerve involvement. Tongue pain. Jaw pain or stiffness, reduction in opening of the mouth, white patches, leukoplakic patches, erythroplakic patches in your mouth or lips. So almost we have a break time.